spending, 4.9 trillion in 2023. Like we were saying, $14,570 per person, even if it was subsidized. That's 17.6% of the GDP of the United States. Affordability, 38% of insured adults under the age of 65 worry about premiums. 50% are worrying about deductibles. I have private health insurance. My deductible is almost like $3,000, $4,000, something like that. I know people who have it up to $7,000. Subsidies, $888 a month net subsidies, almost $1,600 without it. This is like a year or two ago. Insurers are already pricing 2026, assuming subsidy cuts, adding 4%. So they're adding 4% on top of what they're already going to charge without the subsidies. So you're telling me the government giving you free money makes you not have to charge less? Shouldn't it just be the same? Just depends who gives you the subsidy or not? Tell me that's not backwards. Maryland, they have an all-payer budget save plan. $1.4 billion in Medicare spending over 5 years. California capped healthcare cost growth at 3.5 to 3.2 to 3.0%. Employers often pay 2 to 300% of the Medicare rates for identical services. Imagine if private healthcare was paying at least half of what they were. Your premiums might not go up and might even fall. Like I said, Vermont abandoned a single payer system that they were testing out. If this were milk or gas, there'd be riots. People would not tolerate paying this much. Instead, it's hidden under jargon like adjusted rates, which is horse manure. Let's talk about a couple small questions, right? Why is $400 care in one zip code worth $4,000 in another? Whether you're rich or poor, that's the value. Would you pay $80 for milk if your neighbor paid $8? Probably not. Why are we okay with this insanity in the cost in healthcare? It makes absolutely zero sense. It makes no sense at all why we continue to tolerate it. The state level hybrid plan, let's kind of talk about like that. That's merging some things they've done in other countries, even parts of the United States. Global budgets, Maryland, all payers pay the same negotiated rate. Stops hospitals from chasing volume. They saved 1.4. Obviously we talked about cost growth target in California, but I feel like that's kind of skewed because of how the rest of California's economy set up, and things can kind of go boop, 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 boop. It's just a little bit different than the rest of the nation, which is again why I advocate we do some of these things at the state level to protect the individual at the state level. Let's talk about a market architecture. Tie commercial prices to Medicare, maybe plus 15%, however you want to do it. Transparency. President Trump was working on his first term, kind of fell flat the last 4 years, and then now they're bringing it up again. Publish prices. Fine non-compliance. If you don't do it, you should be fined $10 million per instance. Real quick, everybody would be publishing them prices at $10 million a clip. They'd have zero issue publishing them. Drug purchasing consortiums, right? Pool Medicaid, state workers, and private employers. You could save 5 to 10% easily on the price of drugs that way. You could probably save more depending on the situation.